Yeah. So the current issue is regarding the IMA's notice, which blatantly states that Ayurveda is an uncivil method to treat serious diseases like COVID-19, whereas Ayush Mantralaya's recent recommendation was about using Ayurveda to treat asymptomatic patients and other patients as well. Certainly based on some visible effects, positive effects of the medical treatment. However, Indian Medical Association thinks that this is a placebo, that Ayurveda is a placebo, and it is not a civilized method. So, what is your opinion regarding this?
See, we all know that empty vessels make big sound. So it's the same case here with IMA. Why I would tell you, because it's not out of some empirical evidence only or out of some kind of observation only that the Honorable Ayush Ministry had come up with such kind of proposal. It was their constant research related with the field, which they have done on 4 different formulations, which were there in the text of Ayurveda. And then they found that they are quite a bit effective in infections like this or the pandemic like this. And that's why after the research, which took nearly 6 to 7 months for them to complete it, and then they have come up with such kind of proposition. So it's not all of a sudden or out of the bloom they have come up with something. First, secondly, it's been almost 1 year or more than that now. I guess we celebrated COVID's birthday last month itself. So it's been 1 year and this baby has grown up now. But till date, there is not a single confirmatory diagnostic test with modern medicine. Not neither there is a single confirmatory line of treatment for the same. So people who themselves are devoid of any kind of treatment or even diagnostic test, as a matter of fact, should refrain themselves seriously from making such kind of remarks on other contemporary medical sciences. They should have that much of respect about others, because respect is give and take policy. If they would go on making such kind of remarks, well, we have got quite a bit material to hit them hard back.
Right, sir. So, what IMA is stating is that Ayurveda is not a science. So, how would you explain to even the normal people that Ayurveda is a science? How would people believe that it is actually a science?
See, why do we need to convince people first of all that it is a science? Because if it wasn't, if it had been some kind of black magic, would it survive for thousands of years together in this land and entire world? Today, if we see that the condition is like this, that the entire world is looking at us with some or the other kind of expectations. I'm not just talking in terms of this pandemic, but there are so many issues which are a gray area for modern medicine even as of now. So there are textbook in modern medicine like that of Guyton in modern physiology, in the preface of which the author clearly mentions that every single time with every single edition, we just think that okay, now we know much more about human physiology and maybe now our knowledge is a complete one. But every single time we find out no, there are many gray areas and we have to explore more. The same thing is explained by Acharya Charak, saying that pratyaksham alpam, analpam hi apratyaksham. So tell me, what is more scientific that we need? It is same Acharya Charak who says that sankhya syat ganitam. That means sankhya is something which you need for counting. It's the very beginning of something called as statistics. In Charak Samhita itself, there are references, multiple references, in fact, which tells us that this particular thing called as Ayurveda was not developed just within overnight or within fortnight. As a matter of fact, it took it took years together of relentless research, the amount of efforts put by various ancient sages that we are blessed with as Indians, and then the entire science was completed, and then they put it as Siddhantas. Siddhanta, by definition, is something which would never change. So that, in a manner, I would say that we are blessed with knowledge. So, rather than calling it as merely science, I would say that it is knowledge. There is a difference in between knowledge and science. Like we always say that science is progressive, and when science will be that much progressive that it would attain the state of knowledge, it will be stagnant over there for a while. So we are having that kind of knowledge with us for thousands of years together, with virtue of which we Vaidyas are treating our patients quite effectively even today.
Right, sir. And when we learn about Ayurveda, we come to know that there are certain diseases which are only treated with modern science, modern medical science. They don't have the cure to such diseases, whereas Ayurveda has. So, what will you say about those those diseases?
See, there are two aspects of this question. The first thing is it is high time that we as Indians, and of course the entire global fraternity, should know that there is a difference in between symptomatic relief and cure. These two things are entirely different. What happens is most of the times that we would pop up a pill of painkiller and say that, okay, my pain is gone. But has the ailment really got cured? No, that's merely a symptomatic relief that you're getting. This is the first thing. Having said that, of course, Ayurveda has this entire scientific classification where it clearly mentions that which are the sadhya rogas, which are curable rogas, which are asadhya or incurable rogas, or which are the diseases that has to be managed with the treatment. Like in modern medicine, we say that diabetes is not something to be cured, it is something to be managed. The same thing is told by Ayurveda, that prameha is yapya, and there are a few of prameyas which are sadhya, there are a few which are yapya. So that kind of classification is done by Ayurveda. Now again, when there are contemporary medical sciences, we should understand that the limitation of one could be the scope for the other, and vice versa. So the same thing applies to modern medicine, where there is a limitation from their side. They should be humble enough to accept it, that okay, this is a limitation from our side and you may work over there. On the other hand, when see there is absolute need of surgeries, when there are some grave accidents, at that time if someone says that no, I will start with some Ayurvedic medication, no, that is not expected at all. So that's a limitation right now of the science, or maybe the practitioners, I would say, particularly, because again, the surgery, why it was not developed is a huge thing. I think we would come up to that as well later on, maybe in this interview. But this particular thing I wanted to highlight, that okay, why we are calling it as a science, because it clearly demarks its limitations as well. We are not saying that we are all good for everything.
Right, sir. As you said that the primary motive behind any medical science, may it be modern or may it be traditional over the world, is to cure the patient. But somehow IMA seems to be stubborn enough to not accept that traditional means, may it be Ayurveda or other sciences, may it be Unani, homeopathy, whatever it is, that they are also capable enough or they are also scientific enough in their approach to deal with such diseases. So, why do you think that IMA is acting in such a way?
First of all, let me be clear about this, that IMA is just an organization, although the largest one in the country, belonging to modern medicine degree holders. But largely, if we see that there are so many office holders in the organization who completely lean towards leftist mentality. So I'm bringing this point with a purpose that we all know for years together what has been done by such kind of people to this country. May that be history, may that be medicine, may that be anything. So they are firm with their thoughts that anything that is Indian indigenous to be called as hoax, and whatever they are having is something scientific. So it just represents or reflects their egotism, nothing else. Secondly, it's a huge arrogance, ignorance, both side by side. Along with that, at the end of the day, I look at it as nothing but a business rivalry. Because in a contemporary sciences, if there are so many people running in one race, you will make an attempt to stop everybody others progress. So that's why they are doing it, nothing else. I don't think that there is anything more than that. Why? Because particularly in COVID era, if we go through that, if you will go for past 1 year almost, there is something called as a Central Trial Research Registry of India. It's very much there in the public domain, anyone can access it. And if you will go through the researches or the trials which has been registered for COVID during this era, this particular time period, we find that almost more than 65% of those trials, they belong to Ayush community. And out of those 60%, almost 70% trials are single-handedly from Ayurveda's side. Now, if someone is that much unscientific or placebo, why would we go to register trials for the pandemic like this? So it pretty much answers your question. And that's why I say that A, it is huge arrogance, and secondly, somewhere a huge insecurities, those are involved with IMA.
Right, sir. And Ayurveda has been installed in Indians in their practices since generations, and quite subtly we don't even know that the things we do in our daily life. So they have been passed on to us from generations. So for
Absolutely.
Indians, Ayurveda is like a sanskar. We have been following it since ages.
Yeah.
But so this thing that IMA is trying to do, are they trying to install a new lifestyle, or what we can say, yeah, a new approach to towards curing diseases into Indians, and trying to divert Indians from their own culture? And if that is the thing, then is there enough scope for what they are doing? Like are they going to be successful in doing so, considering the heritage of Indian practices?
Yeah, I would call it as a spoiled approach to, spoil everything that is Indian indigenous. Because as earlier, as I mentioned that, even if you remember, the same thing happened with Ram Mandir issue also. Because I happen to write a book on that Ram Mandir issue as well in Marathi, and that's why, because I am very much closely related with the issue, that's why I'm telling that the same thing happened from leftist over there. They completely kept telling that there was no temple, nothing, etc. And when the archaeological survey and all these evidences came up, suddenly they started flipping the coin and saying what not, that we want hospital over there and completely all this and all that. Now, the same thing is happening with Ayurveda, because for years together, just as you said, you used a very nice term which is called as sanskara, by the way. Sanskar, the term comes from Ayurveda, which means that samskaro hi gunantara dhanam uchyate. That means it is something which would define you as a person, which would convert certain characteristics of yours towards the betterment as well. So that's what Ayurveda is doing for years together, for generations together. Now, if we want to run the international huge pharma cartel, we want everything to be in supplements. No? Now, these days, what we are doing for years together, we are taking things from our diet. There are so many various food culture involved in our country. We are so rich with the food culture as well. Now, just segregate all these things apart, just break them away, and then bring these new things and just bombard us with all these chemicals, synthetically prepared. And that's what is going on. These are all efforts toward that, nothing else, to run a huge business of pharma cartel. That's all.
Yeah, right, sir. So whenever we see that there are liberals dealing with some kind of issue, then there is always this. They have this complete intellectual. What we can say, they have camouflaged the issue quite intellectually, and the thing which is hidden behind, is somewhat dealing, or mainly dealing with economy or finance. So India,
Absolutely.
yes, India is a leading producer of raw materials in pharmaceutical industry. So all in case of the vanaspati which grow in India, so there are specific plants of medical importance which grow in India. So we have the monopoly for it. So when again this happens to be something very similar to what happened in British India, that we are supplying the raw material, and then we are buying the same products made out of the raw material at uh, with at expensive cost. So is this thing again related to this issue, what is happening now, the similar approach?
Not quite same, I would say, because yeah, as you said, yeah, there are many plants which we are blessed with. But actually what happens, what the entire ecosystem is trying is they are just molding Ayurveda into commodity and not the medical science. So I guess you must have heard about this, that Ayurveda is very good to prevent, but it's not so good to cure. Now, from where this narrative comes, you tell me. So the medical science is of course as good as to cure, to prevent, also to cure. Now, when they set up this particular narrative, they are just trying to tell that, okay, we will sell some kind of health supplements out of that also, and you just keep buying that as commodity. So now you won't be outraged because we are not denying Ayurveda. But when the treatment part comes, it's only us who would do the treatment and nobody else. So that kind of narrative, there are constant efforts to set such kind of narratives. And I feel that we as Indians should be very much aware regarding this. We should be vigilant about this, and we should not fall prey for such kind of narratives for sure.
Right, sir. And specifically in case of COVID-19, are there any cases, since you yourself are a practitioner, are there any cases which you know or you could share where Ayurveda has been very influential in treating them with the disease in some way or the other?
Well, there are many in different groups as well. Because as far as, if you remember, that it started with saying that Ayurveda is good for immunity boosting. So immunity modulators, there was a huge wave of immunity modulators. Then they started saying that, okay, you're good for immunity boosting, but don't try to deal with patients. So don't give them medication, don't try to treat them, manage them, because ultimately they wanted to get it converted into potential vaccine customers, nothing else maybe. So it started with that. But by God's grace, there were patients who were coming to Vaidyas like us. My journey of COVID-19 started with patients from the United States, basically. So there was a huge lacuna of the health systems over there, especially for the Indians which are residing there, and they were quite concerned with the situation. So from there, I could start getting the exposure and the experience regarding this disease. Started learning about it, started learning about the research papers which were constantly there in the public domain. Many of them were of open access also because of all this duration, and there are certain subscribed research papers as well. So from there, the first hand knowledge came, and then we started going back to our roots from our texts like Charak Samhita, like Sushruta Samhita, like Ashtanga Hridayam. From there to the recent texts, like there are certain texts called as Aushadhi Gunadharma Shastra in Marathi. So started learning that, getting some more and more material out of that. And as soon as the patients were approaching, and again by God's grace, there were cases where the pneumonia was developed completely, but the RT-PCR of those patients were negative. So in terms of government policy, those were not COVID patients, but the pneumonitis was already there. The private health sector told them the bonker prices to get admitted just to get the bed, and that's why the patients approached us, so to be very frank, as a last option. But still, it could give the exposure to Vaidyas like me. We started treating them successfully and started managing the condition quite well. And I guess you may be amazed to know that almost before 5 months, the Honorable Ayush Ministry has come up with entire detailed protocol of how to handle COVID-19 patients with Ayurveda medicines. In fact, all the Ayush systems, out of which the Ayurveda protocol is the most extensive one, it consists almost 70 pages along with the consent form and every material ready. So that kind of scientific evidence and scientific approach was needed from this fraternity at this time. And I'm quite proud to say that the entire Ayurveda sector was very much responsible enough to react with this manner. And then we started handling such cases, and quite effectively, we are finding that, me and my colleagues, that we could manage those cases very well till date.
Okay. So, since you have a wide experience in this area, so please share with us what is the global perspective for Ayurveda? Because in India, we know that IMA is not that much, it doesn't have that much of authority to ban some kind of medical treatment. They don't stand on those grounds. However, people are completely misinformed about such institutions. The media is what makes them huge. So people don't know whether the institutions they are referring to, they whether have the authority to make such statements or not. So since you have the experience in this area, please let us know what the global perspective for Ayurveda is. How much confidence does the world have on this treatment? Because after Narendra Modi, Prime Minister Narendra Modi started World Yoga Day, National Yoga Day, we saw the entire world joining to the campaign to support yoga and practice yoga for daily life. Now we'll be celebrating National Ayurveda Day. So what is the global perspective regarding Ayurveda?
No, see, when we talk about the global perspective regarding Ayurveda, we should first introspect that what have we done for Ayurveda as Indians? Because to be very frank to you, just as you mentioned about the Yoga Day, the Ayurveda Day, yeah, the celebrations are good. But have we done some concrete work with those regards? Unfortunately, I don't think so. Because even, after Honorable Prime Minister Mr. Narendra Modi has taken over, we were expecting a lot. Of course, he has done a lot, no doubt about it, that there is a Ayush ministry which has been given the separate charge of, but we expect definitely more than that. Now, by meaning that, what I exactly mean is, take an example of China. So People's Republic of China, they have tackled SARS or MERS like infections, and there are clinical research papers in public domain as well. They have tackled that with their traditional Chinese medicinal system. They have encountered COVID-19 with it as well. And for all this, their government fund for such kind of researches, or they back up strongly. Unfortunately, we implemented something called as the what do you call it, as the Epidemic Act, which actually belongs to the British era, which denied Ayurveda practitioners to treat this particular or to manage this particular disease with their own terms, with their own understanding, as a standalone. Now, this is such an unfortunate state that we are living in 21st century in the land, in the homeland of Ayurveda, and we are being denied to give our treatment, our service to people single-handedly. Now, what do we expect that world should back us with? So we were actually expecting that, again, as per the Constitution of India, as per the Article 21 of Constitution of India, it is a basic right of Indian citizen to choose his or her way of treatment. So if you are denied with the basic right, what's the use? So actually, even today, Vaidyas like me are very much hopeful from Honorable Prime Minister or even from Honorable Ayush Ministry that they should back up the work like what we are doing, so that there will be more and more encouragement to Vaidyas, to the field of Ayurveda as a medicinal science, not merely as a community. And there have been many institutions as well. Even if you take that AIIIA from Delhi, or there is Chaudhary Charak Brahma Prakash Sansthan from Delhi, where Professor Dr. Vidula Gujarwar is doing some excellent work for past 5 to 6 months. There are so many people who are actually restlessly working for this pandemic. I think that government should give them backup and at least the opportunity to work single-handedly rather than running behind the vaccination charade.
Absolutely, sir. So, as we see now, the government is somehow now trying to be, it has its uh, Atmanirbhar Bharat initiative on a go, and is asking people and industries and enterprises to become vocal for local. However, these are the practices like Ayurveda, which are extremely local in their nature. They are not being that much supported. We see a beginning somewhere today, but what do you expect in future? Like, obviously we need to go much ahead now. This is just the beginning. So could you please elaborate that what are we expecting to see ahead in case of Ayurveda,
See,
even
we
not
need
only from the government but also from the people?
Yeah, we need too much of efforts from every side, as you said, not just the government, but the public sector as well. So, what I would say is that, see, when we say that Atmanirbhar Bharat or go vocal for local, Ayurveda is such kind of thing that right from farmers, you can involve so many people of various professions. to flourish this particular field, it would benefit them all, both financially as well as with their with respect of their health. There is a sector for cow protection as well, which goes hand in hand with Ayurveda. Indian indigenous cows, we have spoiled the breeds like anything for years together with some weird mentality. And now we should come back with that flora fauna also. So there should be the support for such kind of the planting as well, along with the production. I would give you an example of government of Kerala. Though there are communists in government of Kerala for so many years together, but say they are so much supportive to Ayurveda that there is something called as Aushadhi pharmacy, which belongs to Kerala government, which manufactures Ayurveda medicine. I guess it's the only state in the entire country which manufactures such kind of things. I think that this model can be replicated in each and every state of India. There was something called as Vana Dhana Yojana as well, which has been started, I guess, past 3 years or 4 years back in Jharkhand. So it should be copied in each and every state. And then there should be certain efforts, like we are making efforts with the help of Mr. Amitabh Bachchan to follow the practices like social distancing and wear mask. Why can't we go to practices like drink kada and eat chavanprash, do exercise regularly? That is something called as vocal for local. Yeah, we need some innovative minds to push some kind of ideas in the mainstream. But in coming years, I hope to see all these changes to happen, because I am, as I said, very much hopeful with the current government with these regards.
Right, sir. And in case of education, it seems may it be Ayurveda or anything that is completely indigenous in nature, we are on the back foot to learn such things. Like we don't know the background of things which were born in our own land, the concepts which have been brought up in our own land. We know the latter part, or in fact we know the western conception, the western perspective of these things. So in that area, what is your opinion?
There has to be huge changes, as I said. We know about the French Revolution, the Boston Tea Party. I don't know what is the relevance of all these things with our country. And on the other hand, we hardly know anything about the history of may that be Guru Govind Singh Ji, may that be Chhatrapati Sambhaji Maharaj, may that be Bajirao Peshwe. So there are so many eminent characters in our history. Our history is so much blessed that it should be written with golden letters actually, and we hardly know anything out of it. Again, because of these particular mindsets leaning towards left, they had captured all these institutes till date, and they deliberately push all this history which was leading towards communism or Maoism particularly. So now this is a time to change all this. Okay, there would be people who would say that, I mean, all these people only, they would keep crying that, saying that it is saffronization of education. I don't know what is the saffronization of education, because if it is saffronization of education, what they were doing was either the greenition of the educational system or the radiation of the educational system. So there are no such colors. What they put, I mean, that's what is going to happen. I mean, this should happen in our country. If we are not going to learn our own history, our own geography, our own sciences, what are we good for? We will just simply end up with finishing and landing into identity crisis, and that's what all these elements want, nothing else. So we should be very much careful about it in coming years.
Right, sir. So things about Indian philosophy, like the schools of Indian philosophy, from where all the knowledge has been, all Indian knowledge initiates. So such things are only taught when you opt for such subjects. Like if I am an art student and I opt for philosophy, I am learning such things. If I opt for history, then only at that level. School level, people don't learn all such things, and later they don't, everyone doesn't get a chance to learn such things. And today when they become citizens of the country, individual citizens of the country, to take decisions about their life, they are absolutely disinformed or misinformed about Indian culture. So how does this affect the decision that people make regarding indigenous ancient Indian sciences of like Ayurveda?
It affects in two ways. The first of which is just what IMA is doing. With the same letter with which we began the topic with, there was a particular statement saying that within last half millennium, we have deliberately and with efforts developed our branch of surgery and so on and so forth. Whereas actually Sushruth is a well-known and well-documented father of entire world's surgery fraternity. But these people are rejecting it. Why? Because they were never taught so. Now in Sushruta Samhita, where we get so many of references of surgical procedures, of certain tools to be used in surgery, right from the forceps to scalpels, to there is Shadvida Shastra Karma, 6 types of surgery, or 60 types of efforts to be put to heal a wound. Now, all those things are vanished somewhere because they were never taught in schools. So that's what happens, what has happened with ill-informed IMA, first thing. And secondly, on the other hand, now what is happening with people? That all are expecting, like, there will be vaccine and God himself would give the vaccine and there will be boom. The entire pandemic would go on. It would vanish. That's not going to happen. It's as simple as that. And that's where we needed something like Ayurveda, which is acting sufficiently, acting responsibly, and acting effectively. But unfortunately, people are so much misinformed that it took people like me also, people like us, to put our efforts in front of them also. Of course, we did it with evidences, not merely on tall claims or something like that. But it would have been very easy if people would learn all these things in their curriculum right from their school days.
Right, sir. So most of the topics which I think were associated with this issue have been covered. So if you want to share anything else in this regard, then please go ahead, sir.
No, all I want to say that as Indian citizens, let's be vigilant regarding our own science, regarding our own rich history, because we are really blessed with all these things. Let's not fall prey for the propaganda of leftists predominantly, who actually want to destroy the civilization. It's a longer term thing. See, for years together, they have been trying for it and they will keep on trying for it. The only way to answer them or to counter them is to put our work in front of the people. But similarly, as I said, the government should be equally supportive for the same, and the people should be vigilant about it, that what they are seeing in front of their eyes, they should at least believe that. And rather than doubting their own sciences and falling prey for such kind of propaganda, of course, I do not expect anything from media channels, yeah, because of course we know that the propaganda are run by whom. So that's why if there are a few left like you guys who are keeping all these things in front of people, media's role is very much important into this. And that's why actually I'm very much thankful to your channel for having me speak regarding all these things. And I think we as Indians should make that awareness at a huge scale in people, and it should be constant efforts from like-minded.
Thank you, sir. It was a pleasure talking with you. We hope that that Indians accept Ayurveda as as a sanskar which they don't know they have been following through all these years. So
They will. There are changes happening, and trust me, soon we will see that Ayurveda will actually be the mainstream in Indian medicinal system, and then no one would ask to such people like that of IMA.
let's hope for the best, sir. Thank you for joining with us.
Thank you. Thanks a lot.
Thank you.